How to use Doctors ABCD to help deal with a medical emergency. If you come across someone who appears to not be moving, is maybe also a funny colour, and is unconscious, then think about Doctors ABCD. Doctors ABCD, which is an acronym that could help us keep someone alive. D stands for danger. Look around. Look for any signs of danger, such as slip hazards, electrical circuits, or dangerous animals. If there is no danger, then think of R for response. Ask the person, "Are you okay?" Shout at them as well. Gently poke the person, as they may be asleep and will wake up, so all is okay. But if they do not respond, then think of S for shout. Shout for help. Call an ambulance. Shout for someone to call 112 or call 999. Then think of A and open their airway, because if this is blocked, then the person will not be able to breathe. Open their airway by placing one hand on their forehead, the other hand under their chin, and gently tilt their head backwards, so their airway is opened up. Then think of B for breathing check. Look at the person's chest for at least 10 seconds. Look to see if their chest rises and falls. If it does, they are breathing and they'll hopefully be okay. But if they are not breathing, then think of C for chest compressions. Before you start to give compressions, stop. Remember, when you push their chest downwards, they will exhale, breathing out, and so could also emit airborne germs such as COVID. So to prevent this affecting you, get a face mask for the unconscious person and place it on them. But I don't have a face mask. Then use a jumper or piece of cloth and gently lay it over their face. Then you are ready to start. But how far down should I push? On a child or small adult, you should push down about 5 centimetres. On a larger adult, you should push down about 10 centimetres. Place one hand flat and locked with the other and push their chest slightly left of centre, doing so at about this rhythm, and keep doing this until help comes. Don't worry about giving breaths, just do the chest compressions. Giving chest compressions is tiring, so do stop for 30 seconds to give yourself a rest, also shouting for help as you rest. Hopefully someone will hear you and come to help, when you can then alternate in giving the compressions. After a while, if the chest compressions are not working, if you can, use the final letter of D for defibrillator. Get the nearest defibrillator, turn it on and simply follow its instructions. Do you know where your nearest defibrillator is? If not, there are many apps for mobile cell phones which can locate your nearest defibrillator, and they can play music that will play the ideal beat to give chest compressions to as well. Doctors ABCD. Check for danger, try to get a response, shout to get help, open the airway, check their breathing, give chest compressions, and use a defibrillator if one is nearby. Doctors ABCD, an acronym to help us deal with a medical emergency.